Hello learners, welcome to the module on the lymphatic drainage of the thorax. The lymphatic drainage of the thorax will be discussed under the following headings. First one, lymphatic drainage of the intercostal spaces, that is the body wall. Lymphatic drainage of the structures like pleura, lymphatic drainage of the lungs, lymphatic drainage of heart, and also finally we will be talking about the lymphatic duct as well as the thoracic duct. Let's begin with the lymphatic drainage of an intercostal space. You are all aware that an intercostal space has an anterior part and the posterior part. Similarly, the lymphatic drainage of the intercostal space will also be discussed under lymphatic drainage of the anterior part and the lymphatic drainage of the posterior part. Let's begin with the lymphatic drainage of the anterior part of an intercostal space. You are all aware that there are certain nodes called as anterior intercostal nodes and internal mammary nodes. So the lymphatics from the anterior part of an intercostal space will of course go to these nodes. That means they pass to the anterior intercostal and internal mammary nodes. So where do the efferents move into? Efferent from these nodes join with the tracheobronchial as well as brachiocephalic nodes to form something called as bronchomediastinal lymph trunk. The bronchomediastinal lymph trunk joins with the right lymphatic duct on the right side and the thoracic duct on the left side. Let's talk about the lymphatic drainage of the posterior part of an intercostal space. Lymphatics from the posterior part of an intercostal space pass to the posterior intercostal nodes. So the posterior intercostal nodes will give out efferents which in the lower four spaces unite to form a trunk which will eventually open into the cisterna chyli. You are all aware of the term cisterna chyli, which is the one which forms the which continues as the thoracic duct. Efferents from the upper part of the posterior intercostal spaces drain into left and right bronchomediastinal lymph trunks. As discussed earlier, the bronchomediastinal lymph trunks join with the right lymphatic duct on the right side or the thoracic duct on the left side. Let's discuss the lymphatic drainage of the pleura. From the knowledge of anatomy of the pleura, you are aware that pleura has got two layers. The outer layer is called parietal pleura and the inner one is the visceral pleura. So the lymphatics from the parietal pleura will basically go into the nodes similar to that of the body wall, something like the intercostal nodes, the internal mammary nodes, the posterior mediastinal as well as the diaphragmatic nodes. The visceral pleura or the pulmonary pleura drain into the bronchopulmonary or the hilar lymph nodes. Let's discuss the lymphatic drainage of the lungs. The lymphatics from the lungs have been broadly classified into superficial plexus, which drains the peripheral part or subpleural part of the pleura, the lungs, and then the deep plexus, which drain the deep part of the lungs. The lymphatics from the superficial part drain the peripheral lung tissue and will continue further into the bronchopulmonary lymph nodes. Similarly, the lymphatics from the deep part drain the bronchial tree, the pulmonary vessels, as well as the connective tissue septa. They drain into the bronchopulmonary lymph nodes. This is a slide which summarizes the lymphatic drainage of the lungs. So you can just make out here the lymphatic drainage have been divided into superficial plexus and the deep plexus. Superficial plexus drains the peripheral or subpleural part of the lung, whereas the deep plexus drains the deeper part of the lung. Lymphatics from both these places will go into the bronchopulmonary nodes, which will continue to drain into the tracheobronchial and into the para and pretracheal lymph nodes. We have discussed earlier the lymphatics from the tracheobronchial nodes will drain into the bronchomediastinal lymph trunk, which will ultimately drain into the right lymphatic duct on the right side or the thoracic duct on the left side. Let's discuss the lymphatic drainage of the heart. The lymphatics of the heart accompany the coronary arteries, and hence we are all aware that there are right and left coronary arteries. So similarly, the lymphatics form two trunks, the right and left. The right trunk drains into the brachiocephalic nodes, whereas the left one drains into the tracheobronchial nodes. You must be aware by now how the lymphatics from the brachiocephalic and tracheobronchial nodes eventually drain into the right lymphatic and the thoracic duct. Let's now come to the last part of the lymphatic drainage of the thorax. Let's talk about the thoracic duct. It is the largest lymphatic vessel which drains the lymph from most of the body. Look at the image. The thoracic duct is shown in green color. It measures approximately 45 centimeter and it's around 5 millimeter wide. If you just look at the picture, it appears beaded in appearance. Just look at the lower part. It begins at the level of T12 vertebra inside the abdomen as a dilated structure called as cisterna chyli. From there, it extends all the way into the thorax and into the upper part of the neck and extends up to the junction of left internal jugular vein and left subclavian vein. As informed earlier, the thoracic duct looks beaded in appearance. This is due to the presence of numerous valves in its lumen. The area of drainage of the thoracic duct has been shown in the image here. The right side of the image, which is colored in green, just shows the area of the drainage for the right lymphatic duct. So the thoracic duct drains lymph from all parts of the body except the right head and neck, the right chest wall, the right lung, the right heart, the right surface of the liver, and also the right upper limb. What does it contain? It contains milky white fluid, which is chyle. This is because these are the products of absorption from the intestine. This slide basically shows two images. The one on the right side just shows how the thoracic duct is formed as a continuation of cisterna chyli in the abdomen in front of the lumbar vertebra, and you can see the course of the same in the posterior mediastinum and then in the superior mediastinum, and finally trace the line upwards to drain into the left venous angle. The other image on the right side of the slide actually shows the drainage of the lymphatics of the body. The 75% of the lymphatics from the left upper half and also the entire lower half, which is colored in brown, is drained by the thoracic duct, whereas on the right side the 25% of the lymphatics drains into the right lymphatic duct. Just to say the course of the thoracic duct again, it begins as a continuation of cisterna chyli, which is a dilated sac at the lower end of the thoracic duct inside the abdomen at the level of T12 vertebra. It enters the thorax through the aortic opening in the diaphragm. It courses through the posterior mediastinum. It crosses T5 from right to left side, and it crosses on to the left side. Termination, it opens finally into the junction of left subclavian and left internal jugular vein, which is called as the left venous angle. The tributaries of the thoracic duct can be broadly classified into the tributaries inside the abdomen, that is abdominal tributaries, the thoracic tributaries, and also the cervical tributaries. The abdominal tributaries include, you can just look at the lower part of the picture wherein it shows that the thoracic duct is an upward continuation of cisterna chyli. Inside the thorax, there are tributaries which are a pair of ascending lymph trunk which drain the upper lumbar lymph nodes, a pair of descending lymph nodes or lymph trunks which drain the posterior intercostal lymph nodes and also the posterior mediastinal lymph nodes. The tributaries in the neck or the cervical tributaries can be classified as left jugular lymph trunk which drains the left half of the head and neck, left subclavian lymph trunk which drains the left upper limb, and left bronchomediastinal lymph trunk which drains the left lung and left heart. Let's talk about the clinical aspect of the study of the lymphatic drainage of the thorax. Injury to the thoracic duct. The thoracic duct is commonly injured in surgical procedures of the posterior mediastinum like lung surgery. It can cause collection of fluid inside the thoracic cavity which is called as chylothorax. This can be injured, the thoracic duct can be injured during block dissection of the neck also, and it can lead to the formation of chylous fistula. The thoracic duct may get obstructed in filarial infection leading to widespread effects like chylothorax, chyloperitoneum, chyluria and also chylocele. These are some of the applied importance of knowledge of lymphatic drainage of the thorax. That concludes our session on the lymphatic drainage of the thorax. Wish you a happy learning. Thank you.